The call came while I was sitting in the infusion center for in my arm, watching poison drip into my veins to kill the cancer trying to kill me. Rebecca, we need to talk about the wedding date. My sister Olivia's voice had that edge I'd learned to recognize. The one that meant she'd already decided something and was simply informing me of my compliance. What about it? Memorial Day weekend is perfect. The venue has an opening and Connor's family can all make it. But it conflicts with one of your chemo sessions. I looked at the 4-bag at the other patients around me in various stages of treatment, at the nurse who just checked my vitals because the side effects were particularly bad this round. Olivia, I can't miss chemo. The treatments are scheduled specifically. Can't you just reschedule? Move it to the week before or after. This is my wedding, Rebecca. I've been planning this for months. Chemo doesn't work like that. The timing is critical. My oncologist. Oh, come on. It's one session. Surely they can be flexible. You're being dramatic about this. I closed my eyes. I have stage 3 breast cancer. The treatment protocol is 18 weeks of chemotherapy followed by surgery. Missing a session could. Could what? It's 1 week. You're not going to die from waiting 7 days. She paused. Look, I know you're going through something difficult, but this is my wedding. My one special day. Can't you think about someone other than yourself for once? The nurse approached, having clearly overheard. She shook her head sympathetically. I can't miss the treatment, Olivia. Fine. Then come to the wedding bald. But you're not ruining my photos by looking sick. Wear a nice wig at least. And maybe some extra makeup to hide the cancer look. She hung up. The nurse touched my shoulder gently. Your sister is in medical school? Johns Hopkins. 3rd year. Top of her class. And she just asked you to skip chemotherapy for a wedding? Yes. The nurse's expression hardened. That's not just ignorant. For a medical student, that's dangerous. I didn't respond. What could I say? That my family had always prioritized Olivia? That when I was diagnosed 6 months ago, my mother's first concern was whether I'd lose my hair before Olivia's engagement photos. That my father had asked if I could time the surgery to not interfere with Olivia's medical school graduation? My cancer was an inconvenience to my sister's timeline. The family dinner was 3 days later. Mom had insisted, we need to finalize wedding plans, and Rebecca, you really should make an effort to participate more. I showed up wearing a scarf to cover my thinning hair, exhausted from the latest round of treatment. Olivia was radiant in designer clothes, her perfect hair and perfect skin glowing with health and privilege. Rebecca. Mom air kissed near my cheek, careful not to actually touch me. Look, while you're here, come see the seating charts. The dining room table was covered in wedding planning materials. Color swatches. Vendor proposals. Guest list. My father poured wine for everyone except me. You probably shouldn't with the medications, right? Olivia launched into wedding updates. The dress. The flowers. The honeymoon in Bali. Every detail meticulously planned, breathtakingly expensive. And the date is definitely Memorial Day weekend, she announced, looking directly at me. I've already sent save the dates. Olivia, I told you that's my chemo week. And I told you to reschedule. Have you talked to your doctor? Yes. She said missing a treatment could compromise the entire protocol. The cancer could progress. I could. Oh, please. Olivia rolled her eyes. You're being overdramatic. I've been studying oncology this semester. One mistreatment isn't going to kill you. My mother nodded. Olivia's right, dear. She's at Hopkins, one of the best medical schools in the country. Surely she knows what she's talking about. She's a 3rd-year student. My oncologist has been practicing for 20 years. Are you seriously going to take medical advice from some local doctor over your sister? Dad frowned. Olivia is going to be a doctor. A real one. At a top hospital. I am seeing a real doctor. Dr. Sarah Morrison is the head of oncology at Rebecca. Olivia's voice was sharp. This is my wedding. My one special day. I have been planning this for a year. You've known about your little medical situation for what, 6 months? Surely your treatment can be adjusted for 1 week. My little medical situation? Olivia, I have cancer. And I'm getting married. Which is more important, your vanity treatment or your sister's happiness? I stared at her. Vanity treatment? You think chemotherapy is vanity? Well, what else would you call it? You're pumping yourself full of drugs that make you sick so you can keep your hair and not look old. It's basically cosmetic at this point. The room went silent. Even my parents looked uncomfortable. Olivia, I said quietly, chemotherapy is killing the cancer cells in my body. Without it, the cancer will spread. I could die. You're being dramatic. I've studied this. Early-stage breast cancer is totally survivable with just surgery. The chemo is probably overkill anyway. I have stage 3 cancer. Not early stage. Stage 3. The tumor is. Whatever. The point is you're not dying tomorrow. My wedding is in 8 weeks. I need you there looking presentable, not making everything about your health issues. I stood up, my legs shaky. I can't do this. Rebecca, sit down, Mom commanded. We're not done discussing the wedding. I'm not missing chemo for a wedding. And I'm not going to sit here and be told my cancer is vanity. I walked out, got in my car and drove home to my apartment. I cried the whole way, partly from exhaustion, partly from the soul-crushing realization that my family cared more about wedding photos than my survival. 2 weeks later, I was back in the infusion center when my phone rang. Dr. Morrison's office. Rebecca, this is Dr. Morrison. I need to discuss something sensitive with you. Are you available to talk? I'm in treatment now, but yes. I received a very unusual call today from Johns Hopkins Medical School. Specifically from Dr. Richard Chin, the Dean of Medicine. My stomach dropped. Why? Apparently, your sister Olivia submitted a paper for her oncology rotation analyzing a case study. The case study was you. What? She used your medical records, which she obtained without authorization, to write a paper arguing that your treatment protocol is excessive. She claimed your oncologist is overtreating for profit, and that you could safely skip multiple chemotherapy sessions without significant risk. I couldn't breathe. Rebecca, what she wrote is not just wrong, it's dangerously incompetent. She misrepresented your pathology, ignored your staging and drew conclusions that could kill you if followed. Dr. Chin called me personally because he was so alarmed by the quality of her work that he wanted to verify the actual facts of your case. Oh my God. I walked him through your real diagnosis. Stage 3 triple-negative breast cancer. Aggressive cellular characteristics. High risk of metastasis. The exact treatment protocol we're using and why each session is critical. What did he say? He was appalled. Not just by her medical incompetence, but by the ethical violations. She accessed your records without consent, used your private medical information without permission, and demonstrated such fundamental misunderstanding of oncology that he's questioning whether she should continue in the program. She's going to be kicked out? There's going to be a hearing. The medical school takes ethical violations very seriously, especially when they involve patient privacy and dangerous medical recommendations. Dr. Chin wanted me to inform you because you may need to provide testimony. I sat in silence, processing. My sister had stolen my medical records to prove she was right about me skipping chemo for her wedding. There's more, Dr. Morrison continued. Dr. Chin wanted you to know something else. He's been the keynote speaker at several oncology conferences I've attended. We've collaborated on research. When he heard my name as your doctor, he asked me to assure you that you're receiving excellent care. He knows you. We're colleagues. He's one of the leading researchers in breast cancer treatment. And he was horrified that a student at his institution would suggest you compromise your treatment for a social event. The hearing was scheduled for 3 weeks later. I was subpoenaed to provide testimony about the unauthorized access to my records. My family's reaction was predictable. Mom, how could you do this to Olivia? She's worked so hard. Dad, you're destroying your sister's career over a mistake. She's just a student. Olivia, you vindictive bitch. I was trying to help you and you're getting me expelled. I blocked their numbers and focused on surviving. My treatment. My health. My life. The hearing was held at Johns Hopkins. I sat in a conference room across from a panel of medical school administrators, ethics board members, and Dr. Chin himself. A distinguished man in his 60s with kind eyes and an expression of profound disappointment. Olivia sat with her attorney looking defiant. Dr. Chin began. Ms. Carter, can you confirm that you did not give your sister Olivia Carter permission to access your medical records? I did not. And did you give permission for her to use your case as the basis for an academic paper? No. He turned to Olivia. Miss Carter, student, how did you obtain these records? Olivia's attorney whispered to her. She spoke carefully. My sister talks about her treatment a lot. I took notes. You took notes detailed enough to include pathology reports, staging classifications, and specific drug protocols? She shared that information with the family. Dr. Morrison, attending as a witness, spoke up. That's false. I've reviewed the paper. It contains information from Rebecca's medical charts that she wouldn't have known herself. Technical pathology details, biopsy results, imaging findings. This information could only have come from direct access to medical records. Dr. Chin opened a folder. We've also discovered that Ms. Carter accessed patient records at her rotation hospital using her student credentials. We have digital logs showing she viewed her sister's file multiple times. Olivia's face went pale. That's a HIPAA violation, one of the ethics board members said. A serious one. Dr. Chin continued reading from Olivia's paper, his voice increasingly stern. You wrote, and I quote, "The patient's treatment protocol represents excessive intervention driven by profit motive rather than medical necessity. Chemotherapy could be safely reduced or eliminated without significantly impacting outcomes." He looked up. Ms. Carter, your sister has stage 3 triple-negative breast cancer. This is one of the most aggressive forms of breast cancer. Without the full treatment protocol, her 5-year survival rate drops from 70% to less than 30%. You're not just wrong, you're recommending something that would likely kill her. I was just exploring alternative approaches. By using your sister's stolen medical records to argue she should skip treatment for your wedding? The room went silent. Yes, Dr. Chin said, we know about that too. We spoke with your family members who confirmed you've been pressuring Rebecca to miss chemotherapy to attend your wedding. That you called her treatment vanity, and suggested one session wouldn't matter. Another board member spoke. Ms. Carter, you do understand that as a medical student, you're held to professional standards? That suggesting a patient skip critical cancer treatment demonstrates unfitness for the profession. Olivia's attorney tried to object, but she cut him off. She's my sister. She's being dramatic about everything. The cancer probably isn't even that serious. She just wants attention. Dr. Morrison stood. I've brought Rebecca's actual medical files. With her permission, I'd like to show the panel exactly how serious her condition is. I nodded consent. Dr. Morrison displayed my scans on the screen. The tumor. The affected lymph nodes. The pathology showing aggressive cellular characteristics. This is not drama, she said quietly. This is a woman fighting for her life. Every treatment matters. Every session is scheduled based on careful analysis of how to give her the best chance of survival. And this student, she gestured to Olivia, violated her privacy, stole her medical information, and used it to argue she should compromise her treatment for a party. Dr. Chin closed the folder. Ms. Carter, the panel will deliberate, but I want to be clear about what we're considering. You violated HIPAA. You breached patient confidentiality with your own family member. You demonstrated gross medical incompetence in your assessment. And you prioritized a social event over a patient's survival. He paused. These are not the qualities we want in physicians. Olivia was expelled from Johns Hopkins 2 weeks later. The ethical violations were too severe. The medical incompetence too dangerous. The breach of trust too complete. She blamed me entirely. So did my parents. The voicemails and emails were brutal. You destroyed your sister's dreams over a grudge. She was trying to help you and you got her expelled. What kind of sister does this? I never responded. I was too busy with chemotherapy, with healing, with fighting for my life. Dr. Chin sent me a personal note. Ms. Carter, I want you to know that Dr. Morrison is providing you with excellent care. Your sister's assessment was not just wrong, it was dangerously incompetent. Please continue your treatment exactly as prescribed. You have a strong chance of beating this, but only if you don't listen to people who value a party more than your life. I framed that letter and put it next to my treatment schedule. I finished chemotherapy 3 months later. The surgery was successful. The cancer was gone. During my final scan, Dr. Morrison smiled. Clear. Complete remission. I cried. From relief. From exhaustion. From the overwhelming weight of having survived despite my family's interference. You did it, Dr. Morrison said. You fought hard and you won. Thank you for believing me. For protecting me. Always. That's what doctors do. I walked out of the hospital cancer-free, into a life without my family but with something more valuable. The knowledge that I'd chosen survival over their approval. Olivia never apologized. Neither did my parents. 2 years later, I heard through extended family that Olivia was working as a pharmaceutical sales rep. She'd applied to other medical schools but been rejected. The ethical violations followed her. My mother called once, asking if I'd consider writing a letter supporting Olivia's reapplication. I hung up without answering. Some relationships can't be saved. Some people will always choose the wedding over your life. And some lessons you learn at the cost of everything you thought family meant. But I survived. And that was worth more than any relationship built on the expectation that I should die conveniently.